And in death on this Monday, an Oldsmar woman decapitated, a child thrown from a St. Petersburg bridge. Crimes that shock the Bay Area. Now, Pinellas County's top lawman says crimes involving the mentally ill are on the rise. Bay News 9's Al Rochelle asked Sheriff Bob Gualtieri what needs to be done to better protect the sick, the community, and first responders.
Joining me right now is Sheriff Bob Gualtieri, Pinellas County. Good to see you. All right, mental health issues. I know that you guys have had a tough time, and we've actually seen an uptick in the number of mental health cases that you're dealing with. Why do you think that is?
Well, I think that twofold reasons, really. One is that in some cases, law enforcement is not dealing with them the best that we can in diverting these people out of the criminal justice system so that they're on a revolving in and out of the jail and in and out of the system.
Yeah.
At the same time, the mental and behavioral health system is not doing the best job that it can with long-term care, with case management, with navigating these people. So what we're seeing is a high volume of people that are jumping back and forth between the criminal justice system, the jail, and the mental and behavioral health system. So it really requires some long-term care and some intervention, and law enforcement doing a better job of identifying this behavior as being mental and behavioral health, not criminal.
Right.
Don't put them in the jail, put them in that revolving door. So I think it's a couple of aspects.
And you know what happens in the media is then, because those cases become sensationalized, where we had the guy who killed his mother with a hatchet,
right.
And then you had the situation at Florida State University, which was just so tragic, where people were trying to get this guy help. They couldn't in time. He shoots somebody, he gets killed, on and on and on. Is this happening in other places too?
It is. You know, and the jails are inundated. You know, we have about 2,800 inmates in Pinellas County Jail.
Okay.
1,000 of those 2,800 have mental and behavioral health issues. We have 600 on psychotropic drugs today as we sit here in the Pinellas County Jail. But it's not just us, not just the big counties, it's the small counties.
Yeah.
Up in northeast Florida in Clay County, they have a maximum inmate population of about 450. 25% of them have mental and behavioral health problems. So it's a lot of people, and the criminal justice system and the jails have become the repository, and it's just not being dealt with the way it needs to.
Well, then who is responsible for these individuals?
Well, that's a complicated question, a complicated answer.
Spell it out if you can.
So you have a lot of providers out there. You have a Baker Act that provides for assessment, but not necessarily long-term treatment. In some cases it does. And you have crisis stabilization. The problem is long-term, and I'll give you a quick example of this. About a month ago, a woman in St. Pete Beach, she came at deputies with a knife over her head. She wanted the deputies to shoot and kill her.
Yeah.
Luckily, the deputies were crisis intervention team trained. They didn't. At their own peril, they ran away from her and then were able to use non-lethal force to take her into custody. So this is a woman that charged the deputies with a knife over her head,
right,
making threats to them. Within 3 days, she's released from the mental health system. With drugs. You know what she did with the drugs? She threw them in the trash can. So the case man, it's a problem, and it's long-term case management. It's navigating these people. That's not the answer. So when you have somebody that is charging deputies, almost shot and killed, and they would have been justified in using lethal force. Luckily, they made the right decision, and they didn't charge her with a crime. They put her into the mental and behavioral health system, but she's released, and she throws the medication in the trash. This guy in Oldsmar who chopped his mother's head off, sat down at the dinner table. Mom had been giving his medication by surreptitiously putting it in his food. She couldn't put it in his food anymore, so he was off his meds because she was trying to sneak him his medication.
Wow.
The system's breaking down with long-term care, and this is where I think we need to focus, and the system needs to focus.
Okay, then, because it is complicated, you've been to Tallahassee, you were testifying. What did you find to be some kind of a solution? You got a 1-part, 3-part, 10-part, what?
Well, I think two main parts, and this is what I suggested to the Senate and to the House, is that to fund statewide crisis intervention team training for law enforcement.
Okay.
Of the 67 sheriffs in Florida, only 40 participate. So we have 27 sheriff's offices that don't participate at all in crisis intervention team training, which is training the deputies to identify the mental and behavioral health issues and keep the people out of the jail. So we need to expand that and get them better trained and have more extensive training. There's also hundreds of police departments that don't participate. So we need a statewide effort to get the goal being 100% participation. You know, of course, whether we get there, that's a different story. And then on the backside is for the system itself to do a better job with master case management and navigators so that they're and that we're following up with these people, because we're not doing it right. We're doing it well in some cases. We can do it better. We can do it. Law enforcement can. But even if we do it perfectly, but they're going into a system that's revolving them out the door, like that example that I gave you, then we're not accomplishing anything.
But then doesn't this require a whole lot more case managers? Because actually it almost kind of falls over into the DCF thing. They're not related, but in a way they are, is that when you have more sick people, and I'll call them that, you need more caseworkers. But if you don't have more caseworkers, there's not enough eyes on that person to know. Like this one time, one person had been Baker acted 29 times?
Yes, 29 times, and in and out of the jail many times.
Yeah.
So it's not working. So what it's going to take, and that what we are advocating for, is additional funding for the service providers. But what we also have to do, and Florida ranks about 50th in the country in per capita mental health funding. We're at the bottom. So we need more money, but we also need an analysis, evaluation of the current spending, and making sure that we're funding the right programs, evidence-based programs that work. There are some good models around the state. Orange County, Seminole County are doing a good job, and probably better over in Central Florida than the rest of the state as far as a central receiving facility, what they call AOT, which is assisted outpatient treatment. They have some significant programs over there that are working. Miami-Dade County probably leads the state in crisis intervention team training. So I think we need to look around, and those that are working, use them. Those that are not, dump them, and make sure that, one, we're not just throwing money at it. It needs to be done in the right way with an evaluation of what works, because otherwise we're spinning our wheels.
Okay, just walk me through this a little bit. Someone is Baker acted. They get Baker acted, then who is responsible for their care?
Well, here in Pinellas County, they go to a receiving facility, and the receiving facilities are PEMS, or they could go to St. Anthony's or to Morton Plant if they have insurance. Otherwise, they're going to PEMS. And they have a facility in St. Pete. They have one on US 19 in Pinellas Park. And the numbers are staggering. In the state of Florida, in 2013, there were 172,000 Baker Acts. In Pinellas County in 2013, there were 10,000 Baker Acts. Now, a lot of these people are Baker Acted one time. But when I say 10,000 Baker Acts, it's not 10,000 different people. Is that when you break it down, there's the person 29 times. There's high recidivism within a group of people, and those are the same people that are bouncing back and forth. So they go in, they're Baker acted. The maximum under the Baker Act for the initial evaluation is 72 hours. They get out within the 72 hours because the follow-up's not there, and then they come back again, they go to the jail, and they're just bouncing around.
Lastly, because we're almost out of time, reception you got up in Tallahassee. People go, yeah, this is something we need to work on, or do they just go under the rug?
No, I think they're very receptive this year. And in talking to leadership and talking to the governor and the committees, it has Tallahassee's attention. It has the legislature's attention. It's got leadership's attention. Representative Peters is going to file a bill. There's a few others that are out there. I think something's going to be done this year.
Okay, good. Sheriff, thank you for stopping by, and good luck in getting something done.
Thank you.
Gualtieri told state lawmakers during a panel discussion in Tallahassee earlier this month that his deputies respond to 8 mental health calls every day. He suggested expanding crisis intervention teams statewide and more training for first responders. Hungry diners, a poorly marked street, and impatient drivers causing problems on an Inverness road. Coming up, real-time traffic's Chuck Henson looks at a possible solution.
Now, your weather on the 9's forecast featuring Klystron 9.
Travel weather's coming up. Lots of rain going on out to the west.